CPT RVA, page 271, exercise 162. This is a level 2 exercise, and it reads like this.
Radiology. Pregnant female comes in for a complete fetal and maternal evaluation via ultrasound.
Okay, let me reread that. It's a radiology section of the CPT codes, and it reads like this. A pregnant female comes in for a complete fetal and maternal evaluation via ultrasound. Okay, so we're going to give you 3 seconds for you to pause the video and give us the CPT code for this. 1, 2, 3. All right, the answer is 76811. Okay, you got that right? If you got it right, congratulations. Go to the next video, please. If you didn't get it, let's give you a tip. 2 tips, actually. The first tip is...
Start with ultrasound pregnant uterus.
Right, you start with ultrasound and then go to pregnant uterus. What is the other option?
Ultrasound fetus.
Ultrasound and fetus. You would think that that's another option, but this will give you
a different path.
The wrong path, right?
Yeah.
Okay, now the number 2 is the level 2 difficulty. When it's a level 2, it means that there's something that is kind of difficult. And the difficulty for this problem is this.
From the index, you will get 11 codes to check.
Right. There's a lot of codes, so you got to be careful, okay, in differentiating each one. And what are you looking for? Look for
detailed fetal anatomic examination, single gestation.
You have to assume some of these things. It doesn't tell you there's a single gestation, but if they don't tell you, then you have to assume the most common situation, which is a single gestation, right? Because if it were like twins, they would tell you then in the problem. When they don't tell you anything, you have to assume that is the most common thing, which in this case is single gestation. Okay? All right, with these 2 tips, and you know that the answer is 76811, but we need you to find the path to the answer. And we're going to give you 3 seconds for you to pause the video and give us the path to the answer, okay? So 1, 2, 3. All right, now this is the whole summary. The problem is a radiology problem and is a pregnant female that comes in for a complete fetal and maternal evaluation via ultrasound, okay? There's only 1 code, and the code 1 through the index is found like this.
First, you go to index.
Go to the index.
Then you go to ultrasound.
You start with ultrasound.
Then you go to pregnant uterus.
Go to pregnant uterus, and you get
76801 through 76817.
Right, and that's 11 codes, as we told you in the tips. Okay, so we're gonna check those codes in the tabular. So the code 1 through the tabular is found like this.
This is first you go to tabular. Then you go to 76801.
Right.
This is ultrasound, pregnant uterus.
And it says what in the 1?
Fetal and maternal evaluation, first trimester.
First trimester. We don't have that in our text, so we keep looking. The next one says
76802.
Is
each additional,
right?
Yes.
Then keep going.
76805 after first trimester.
Right.
76810 and 10.
Right.
Each.
Right, and then we get to 11. What do we have in 11?
Plus detailed fetal anatomic examination.
Which is exactly what we need, right?
Yes.
Because it says complete fetal and maternal evaluation, okay? So in this one, the fetus is also examined, and that's exactly what we're looking for. Right, so we stop there, or we can continue, right?
Yes, we can
continue, but we have to go back. The ellipsis there, the 3 points means that you continue looking. We're not going to put it here because it's too long, but then you have to go back
for these double slashes.
It means that, yeah, and
76811,
which is the closest one that resembles the keywords of our problem. So that's why we have an equal sign there, and the answer would be
76811.
76811. Okay? Thanks for watching, and please visit our website.